Good morning. If you have decided to study to become a professional hypnotherapist, keep watching our training videos about hypnosis. Hypnosis is a powerful technique with which you can help and improve the quality of life of a great number of your future patients. Remember, read the description of this video where you can find a link to free training classes on hypnosis. And you will be able to download several ebooks also free. Let's see the common features in every regression. Common features in all regression. When we do regressions, we can see a series of common features. This does not mean that if they do not appear, they are not true regressions. According to Dr. Raymond A. Moody, 1990, 12 traits appears in regressions. The experiences of previous lives are usually visual. Most of the patients exposed to regressions say that their experiences consist of visual images. To color, even sometimes also smells and sounds are described. These images are more vivid and more real than daydreaming fantasies, nor are they usually distorted as they are in night dreams. Past life regressions seem to have a life of their own. What is relived in a regression develops on its own initiative. For example, the patient has no control over it. The patient has no control over it. The patient does not decide what is going to happen. He only relives the past. He has the sensation of reliving a film that seems quite familiar to him. The images seem strangely familiar. Reliving a previous life is impregnated with a lot of familiarity, so much so that one can even feel nostalgic. There is a strong feeling of having seen or done before what is being relived now. The subject identifies with the character. Every patient exposed to regression identifies with one of the people he or she visualized in the senses relived. Despite the differences that may exist in psyche, sex, profession, etc., he knows perfectly well that it is him. In fact, he comes out of the trance totally convinced that he really was that person in the past life. During a regression, the emotions of the past life can be felt again. The regressed person feels the emotions of his character in the previous life. For example, if he is being hurt, he will feel pain. If he is reliving a situation in which he was sad, he will feel that sadness. If you are reliving a situation in which you are happy, you will feel that happiness. If you are reliving a situation in which you were happy, you will feel that joy. All human feelings, from love to anger, can come to the surface during a regression session. The events of the past life can be contemplated from two perspectives, first and third person. The regressed patient can relive scenes from a previous life in the first person, within the body being regressed, within the body being relived, or from a third-person perspective, starkly contemplating the action from outside the body of the person with whom he or she identifies. The experience often reflects current issues in the subject's life. In most regressions, the events that unfold usually reveal dilemmas and conflicts that the patient is facing in his or her current life. Many awaken from the hypnotic trance fully aware that the past life experience they have just had is very similar to their current problems. Regression can be followed by a real improvement of the mental state. During a regression session, the patient can experience a catharsis, a psychological process in which finally the retained feelings can be expressed, and a sense of liberation and relief can be felt. They see their current problem from a different perspective, which helps them to make the necessary change and thus overcome the problem. Virtually all patients understand much more about their problem after a regression. Regressions can affect illness. In some cases or regressions, the patient reports a marked improvement and even spontaneous cure of physical symptoms. Regressions develop according to their meaning, not according to historical time. If a patient regresses to several lifetimes at a given time, these lifetimes will appear in a sequence that revolves around an emotional or relational theme, not in chronological sequence. but in chronological sequence. Not in the chronological sequence in which they would have been lived. The main theme that appears in a patient's past life is not the role they play in history, but their psychological and spiritual development. Past life regressions become easier with repetition. The more you try, the easier it becomes to relive a past life experience. The repetition of the experience makes the patient feel more and more at ease in the regressed state, making it easier for the patient to enter the regressed state. Most past lives are mundane. Most of the regressions experienced are ordinary lives of the time in which they are regressed. Very few patients identify with known historical figures. Normally, the patient's memory of a past life reflects a conflict in his or her present life. By means of hypnotic regression, we can quickly get to the root of the problem. If you're interested in learning more about clinical hypnosis, watch our next video, Regressions. Summary of what you have learned. Remember to read the description of this video where you can find a link to free training classes on hypnosis. And you can download several free ebooks. If you have any question, ask them in the comments area. On this topic and many others we will talk about in the channel and in the videos that we will publish. So if you are interested, don't miss our next videos. Thank you very much.